we're very blessed to have a relationship with the Child Development Rehabilitation Center out of Portland and Eugene to provide services to children with special health care needs. And that can be any children whose health is affected. And in this particular clinic, we're helping kids who have primarily difficulties with their body and movement. And so we have a physical therapist who comes down from Eugene, and she assesses those children and what they might need to help them be able to move. Many of them will need wheelchairs or standers, walkers, things that are really have to be very specifically adapted to them.
We deal with lots of different diagnoses, lots of different conditions. I'll do a full evaluation, looking at all the, range of motion, muscle tone, what the kids' functional capabilities are. Talk to the family about what they desire, what their needs are. Talk to them about, their lifestyle. How would they picture using the equipment in the home, in the community? And from there, we kind of come up with some ideas in terms of what we would consider. For example, a wheelchair and a seating system. My main goal is to prescribe a seating system that's going to prevent orthopedic deformity. Keep the kid as healthy as possible in terms of actual structure, but then also optimize function. What can this kid do, and how can we help support that and bring them to the next step of function? The goal is always as much independence as possible.
The great advantage is that by having Daphne, the therapist, be able to come here, make those quick decisions, assisting families, probably allows them to get in their equipment, I would say anywhere from 6 months to 2 years ahead. If a family's got to make extra trips to Eugene, we routinely get cancellations because in the Eugene office, because families just can't get there.
People don't realize what a big deal it is to care for a child with a disability. I mean, a really big deal. Every day, all the time. You have this kid that needs a lot of care, and you also have the rest of your family. You've got the siblings to take care of, you've got work, you've got spouse, and it is a really big trip. It's a financial burden for a lot of the families. It takes a big chunk of time. You have to make a lot of arrangements if you have other kids. You have to haul equipment. That's also been, talked about. And then I think the other big piece is you don't have all of your people in one place. You've got your treating therapist down here that really knows the kid the best, because I see them on the weekly basis or, every day at school. And we try to communicate with local treating therapists, by email or by phone, but there's nothing like being in the same room. I love to come down here and have the treating therapists and have their input. It's so valuable, and the families really appreciate it. And I think that we can make much better decisions in terms of being cost effective, with what we decide to recommend, recommending something that everybody's in agreement that, we really think this is going to work for this child.
It's huge to be able to get the families, the therapists, the vendors, everybody at one place at one time to get extra eyes on the situation and be able to, just make sure we're getting what these kiddos need.
We have a little guy coming in from Gold Hill, and he is now just turned 3 years old, and he is a child with what we call spastic cerebral palsy. So he does not have control of his arm muscles, his leg muscles, his feet muscles, and he actually also has a great deal of difficulty swallowing, affects his swallow muscles, so he's not able to eat, has a special tube for feeding, and so he's been in a wheelchair for about a year and a half, and so he's coming in today because we need to look at his wheelchair, make some adaptations, see if it needs to grow with him. Fortunately, our wheelchairs grow up to almost 5 years for these kids, so they just change out seats, backs.
Well, with kids, it's a little more difficult. Kids grow, and some grow quick, some grow tall, some grow heavy. So every kid is different, but we try to, when we put them in a piece of equipment, we try to give the longest range we can get out of a piece of equipment with some adaptive changes. A lot of times over time, conditions change for the individual. Maybe they get stronger or maybe they get weaker. And with different pieces of equipment, we can adapt to their situation. We try to keep them as mobile and as comfortable as we can get them, as positioned as possible.
Isaac is a good example of a kid who got intervention really early. You know, we've known he had a CP diagnosis early on when he was an infant. We got to know him right away. You know, I have had the opportunity to evaluate him a number of times and, you know, get him into adaptive equipment early, you know, to help, you know, prevent some of the musculoskeletal problems that can happen due to poor positioning, you know, right from the start. We've been able to get him in equipment that optimizes his function right from the start, which is really an important part of cognitive development. You know, some of these kids who are really motorically involved don't have a lot of opportunity to interact with the environment, which is what drives cognitive development. So, you know, if we can get them sitting up and, you know, get them support for their head so they can use their vision, so they can take things in. You know, it's really important to, you know, start this process early.
In the past, these children oftentimes had to spend 2.5 hours to drive to Eugene, have their appointments there, then turn around, come home, and then have to go back again 4 to 6 months later. The therapist now has been very gracious, and we're able to bring her down here 3 to 4 times a year. She's here for 2 days, sees anywhere from 16 to 20 kids, and we have the ability to now get those kids into the equipment they need and get it taken care of in our local community.